Hi, everyone. Welcome to Nashville General Hospital's Facebook Live Wellness Wednesday program. I'm Kathy Poole.
And I'm Kaylin Harris.
Our goal of Wellness Wednesdays is to share information vital to your wellness and health. In support of Colorectal Cancer Awareness Month, today's guest is Betsy Bond, a nurse practitioner in our Digestive Health Center.
The Digestive Health Center at Nashville General Hospital is also referred to as GI or gastrointestinal. Nashville General's Digestive Health Center is dedicated to treating diseases of digestive system, including acute and chronic gastrointestinal illnesses. However, colon cancer screening is one of the most important services they offer. So without further ado, we would like to introduce Miss Betsy Bond.
Thank you, Kathy and Kaylin. Thank you so much for having me. As you mentioned before, March is Colorectal Cancer Awareness Month. And while we provide a variety of services in the Digestive Health Center, we see all ailments of the stomach, liver, pancreas, small and large intestine. We feel that screening for colorectal cancer is probably the most important thing that we do. Did you know that screening is the #1 way to prevent colorectal cancer, which is the second deadliest cancer in both men and women? It can also help detect cancer early when it is still highly treatable and preventable. Screening is important, it's safe, and it saves lives. Now, colorectal cancer is not only the second deadliest cancer in both women and men, it's also the third most common cancer diagnosis. Approximately 1 in 24 people will be diagnosed with colorectal cancer in their lifetime. Colon cancer and rectal cancer affect people of all ages, ethnicities, and lifestyle. No one is immune. We do see that African Americans have a higher risk for colon cancer, however. It's estimated that in this year, 2021, we will have approximately 149,000 new diagnoses of colorectal cancer with about 53,000 deaths, unfortunately. So how does colorectal cancer save lives? Well, let's talk about the digestive system and how colorectal cancer develops. So the colorectal cancer is a formation of abnormal cells in the colon. The definition of cancer is just a growth of abnormal cells that continues to grow and spread. When it's in the colon or the rectum, is known as colorectal cancer. Now, in order to understand how that happens, let's look at the digestive system very quickly. We start with the mouth. When we eat, food goes down the esophagus into the stomach, and then into the small intestine, which is where digestion happens. That's where the nutrients are absorbed. And then the small intestine takes that waste and empties it into the colon, also called your large intestine. And this, my friends, as they say, is where the poop gets real. So you have about 5 feet of colon. There are 4 different parts to the colon. There's the ascending colon, which is from where it starts in the right side, lower right side of your abdomen. The ascending colon goes up. The transverse colon goes across your abdomen. Descending colon goes down, and your sigmoid colon is the final portion of the colon where stool collects in order to before you have a bowel movement. Now, colorectal cancer starts as a non-cancerous growth called a polyp. Polyps develop on the lining of the colon or the rectum. It can take at least 10 years to progress from a harmless clump of cells or a polyp to colon cancer. Polyps that grow from a gland in the lining of the colon are called adenomas. All adenomas have the potential to become cancerous. However, it's estimated that only 10% of them actually do progress to invasive cancer. Once cancer forms in the lining of the large intestine, it can grow and spread to different parts of the body. So how do you know if you've got colorectal cancer? What are the symptoms? Well, there aren't any. In the early stages, colorectal cancer is silent. There are no symptoms. The symptoms appear in the later stages when it is very difficult to treat, and this includes bleeding, blood in the stool, a change in your bowel habits, and lower abdominal pain. So the question is it preventable? And the answer is absolutely. Colorectal cancer is one of the most preventable cancers if you get your screenings early and follow the guidelines. Now, most people will be screened with a colonoscopy, but there are some alternatives to that. The American Cancer Society recognizes that a colonoscopy is the absolute most effective and gold standard, and that screening should begin at 45. However, for some of our population, that's not always the best first choice for them. So there are stool kits you can do at home. I'm sure you've seen the commercials. There are also kits that your doctor can give you that test for the presence of blood or certain markers in your stool. Now, these don't take the place of a colonoscopy, and that's very important to remember, and they're not the right thing for everybody, but they can tell us whether or not you need to have a colonoscopy sooner rather than later. So a lot of people say, well, I don't want to have to do the prep. I don't want to have to take off work. It's difficult. Well, all of these things can be true, but they shouldn't be barriers to getting your colonoscopy. It's actually a very safe procedure. You don't remember anything. You don't feel anything. Our staff takes great care of you. And the only way to truly prevent colon cancer is for a doctor to take a look and remove anything that could possibly be precancerous. So again, if we remove the polyps, they can't grow into cancer. And one more statistic. So with early screening and detection, there's a 90% 5-year survival rate when colorectal cancer is caught in early stages. But if it's not caught until later stages, that drops to 14%. So 90% of the people that have a colonoscopy for screening that have a cancerous polyp, 90% of them will have a really strong survival rate. So colorectal cancer is preventable. It is very easy to diagnose and treat in the early stages. And millions of Americans are skipping the screening, and they miss out on the opportunity to find and treat early cancers. So I have one more slide for you. Or not. Anyway, the last statistics for you are, we all know this is March Madness, in addition to being Colorectal Cancer Awareness Month. Did you know that 1 in 9 quintillion, that is a lot of zeros, 1 in 9 quintillion people will pick a perfect March Madness bracket? The chances of that happening are 1 in 9 quintillion. However, 1 in 24 people will be diagnosed with colon cancer in their lifetime. Now, I'd love to have any questions.
That is an amazing statistic. Yes, thank you for sharing that information on colon cancer and the importance of annual health screenings. Kaylin, do we have any questions?
We actually do. So one of the questions that's coming through our Facebook page is, what are the signs of an obstruction?
So signs of an obstruction, for if you have a tumor in your colon that is large enough that it's preventing the passage of stool. Signs of that would be a change in what we call the caliber of your stool. It may be much smaller, much more narrow. You may have a lot of lower abdominal pain, bloating, cramping. You may get to a point where you're not able to pass stool at all. And these are really serious warning signs that you need to speak to your doctor about immediately.
Thank you, Betsy. And then another question that we had come in is milk or dairy, are milk or dairy products bad for your digestive system?
You know, that's an interesting question. Some people are truly lactose intolerant, which means that they do not tolerate the sugars in the milk and can cause some pretty significant GI distress. Some people are just a little sensitive to milk and milk products, and some people don't have any problems with it at all. There are supplements out there that you can take that help the body digest the lactose or the milk sugars better and can prevent any kind of GI distress from that.
Thank you. Thank you. And then we just got another question in through Facebook. What intervals should you get your colonoscopies after the first one? Is it 5 years or 10 years?
That is a really good question. And the answer to that is it depends on what we find. If you have no family history of colorectal cancer in a first degree relative, that's mom, dad, brother, sister. If you have no family history of colon cancer and your colonoscopy is completely normal, meaning we don't find anything, it's every 10 years. That rate drops to 5 years if your colonoscopy is normal and you do have a family history of colorectal cancer. Now, beyond that, we will tell you when to repeat your colonoscopy based on what we find. That has to do with how many polyps we remove, how large they are, what type they are after the pathologists have a look at them, and where they're located in your colon. So it could be as soon as 3 years.
Perfect. Thank you, Betsy. Thank you very much for answering those questions.
Just to piggyback on that last question, you were talking about the take-home kits. So would you recommend the take-home kits in between those 3 or 5 years?
That's a good question. And I think it would, so the take-home kits are not appropriate for anybody who has had a finding of polyps on a previous colonoscopy. They're also not appropriate for anybody with a family history of colon cancer or anybody that's having any GI symptoms. So the take-home kits are very helpful for folks who are at average risk, no family history, never had a colonoscopy before, and don't have any complaints in their lower GI system. So taking those folks, that may be helpful. And the test called the FIT test, which tests for blood in the stool, that can also be useful to let your doctor know, especially if you start having any GI problems in between your colonoscopy. And one more thing, people ask me all the time, well, how do I prevent colon cancer? Well, high fiber diet, lots of fruits and vegetables, just like your grandmama told you, eat your roughage, broccoli, carrots, corn, all those good veggies, lots of fruits and vegetables, low fat, low salt. Try to avoid smoking, try to avoid highly processed foods. We Americans love our salt. And we love our processed stuff. So those are the best ways that you can keep your digestive system healthy and try to prevent colon cancer.
Perfect.
And it's National Nutrition Month too. So
yeah, that's right.
There you go. You got a little bit of that.
That's right. I was speaking to one of our nutritionists yesterday. So yes, it is. I think it's a great thing that Colorectal Cancer Awareness Month and Nutrition Month overlap because there's so much that has to do with nutrition, diet that affects the digestive system.
Perfect. Well, that is all the time that we have today. We definitely want to thank everyone for joining us for our Wellness Wednesday Facebook Live event, as well as Ms. Bond for coming on and talking to us about colorectal cancer awareness. So if you would like to schedule an appointment for the Digestive Health Center, please call 615-341-4968. Once again, if you would like to schedule an appointment for yourself or your family member, please call 615-341-4968.
Also, don't forget to mark your calendars for next week's Wellness Wednesday event featuring Dr. Nathaniel Klein. He's a highly specialized GYN who provides patient care at our Nashville Healthcare Center Midtown location on Charlotte Avenue. Dr. Klein is one of 3 minimally invasive gynecologic surgery fellowship physicians in Nashville. From mixed augmented reality healthcare application to minimally invasive surgical procedures, Dr. Klein is on the cutting edge of healthcare and technology.
We are really excited to speak with Dr. Klein next week and hear everything that he has to say. He is truly the future of medicine. So we look forward to seeing you next Wednesday, March 31st at 12:15. Have a great day, everyone.
Thank you so much.